we're going to talk about a very serious topic that a lot of people are dealing with right now. So, Dr. Quinn, hopping on into it, what is menopause?
Well, menopause is a serious topic, but I was smiling because I'm thinking about the lady I just spoke with. When I talked about the symptoms, she said that she didn't have the symptoms of mood swings, but she said her husband told her that she did. And I told her, I said, your husband is probably wrong. He's probably wrong, but secretly, I think she probably did. But menopause is a normal stage of every woman's life where they go through normally. It is not any type of disease in most cases. It's a scenario where in the early to the mid 40s, the woman's menstrual cycle or her period becomes irregular. Maybe they might skip a month, it might be sooner, or they might skip 2 or 3 months. But once the woman has 12 months with no cycle consecutively, she's in menopause. And then there's postmenopause, which is for the rest of her life. It's just part of the normal female lifespan.
Gotcha. So before we even get there, obviously, there's always a before you get into real menopause. So what is perimenopause, and how do you know you have it?
Right. Perimenopause is that part of a woman's cycle where they will start missing periods, but that's when some of those symptoms come about, start presenting for some women, but it's more so for some than others. And this includes the mood swings, like the lady earlier today, which she claimed she never had, but her husband was complaining of them. Some women complain of night sweats, hot flashes, and some women can't sleep. And a lot of women have depression, anxiety. There are just so many different symptoms. I could go on, but the bottom line is if you're having symptoms, it's best to go talk to your medical provider, especially if the symptoms are unbearable, because there are various treatments out there that can be very effective.
And now, just another question, too. Brain fog, that's something that can also be associated with menopause, right?
Right, that is correct. That's a scenario where a person might have different releases of certain hormones such as LH, which is luteinizing hormone, or FSH, follicular stimulating hormone, or different levels of estrogen and progesterone being released, and they can get what's called brain fog because they develop these vasomotor symptoms such as the hot flashes, and they can't, in some cases, depending on the woman, she might not be able to think clearly. She can't remember things as well. This is very common with menopause, but these are conversations you need to have with your medical provider so we can look into providing that treatment that could be so effective.
Awesome. And I mean, it is a very unusual time for people. It can be scary, too, for others. Are there some treatment options and some things you want to make sure women know out there today?
That is correct. So the most common treatment, which can cover a lot of the symptoms, is simply to replace the estrogen. So as a woman goes through menopause, they have decreased release of estrogen from their ovaries, and you can take synthetic hormonal oral estrogen, but if you still have your uterus, meaning you never had a hysterectomy, usually your medical provider will provide progesterone along with the estrogen, which protects you from having a higher chance of developing uterine cancer. Also note that a lot of women, like I said, get a lot of anxiety, depression, insomnia. Then a lot of doctors, such as myself or an OBGYN, might prescribe antidepressants, anti-anxiety medication, and also sleep medication for the mood changes. But honestly, every woman that has any concern needs to go speak to her medical provider so that they could discuss what's going on, and then they could try different treatment options that can change a woman's life for the better, and also the husband's life.
Understood. So now you talked about relief options, some treatment options, and other things. Just to wrap this up, can you please give the women out there some hope? Because, again, it's a very unfamiliar time for a lot of people.
Well, one thing I really want to put out there that's very important and is spoken about quite a bit by my patients and my colleagues according to their patients is the fact that during menopause there's less estrogen, and there could be a great deal of physical discomfort and decreased desire for relations with your significant other. This is something that you don't want to be ashamed to discuss with your doctor, because there are types of topical ointments that we can use with estrogen in them that can make it so that you and your significant other can enjoy intimacy at a good level, which can be very good for that relationship.